11:17. Thank you. First, I want to go over a couple things. We do now have two sections for public comment. The first public comment section is to address items on the agenda particularly. And then the second public comment that is at the end of the agenda is for any other items that are not on the agenda, or please refrain from speaking to a previous item that you already spoke on. So that will clear that for clarity. And now we will go into, Chair Lubes is away. She could not be here today, but she does have an excused absence, and I am the vice chair of this committee, and I am in her place just for today. So want to clear that as well. This is my first time. Be patient with me. Thank you. And now we'll move to roll call.
Hoffman.
Here.
McGillivray.
Here.
Jackson is absent with notice. Nelson.
Here.
Cavell.
Here.
Gingell.
Here.
Kuhn.
Here.
Powell.
Here.
We have a quorum.
Now we will move to the Pledge of Allegiance. Let's all stand, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Now we will move to item number 4, which is the approval of the minutes. Are there any corrections to the minutes of the previous meeting? Yes, Commissioner Nelson?
Oh, I'm making a motion.
Okay. Oh, sorry.
Motion to approve the minutes?
Motion by Commissioner Nelson, supported by Gingell.
Is there any discussion?
Is there any discussion? Hearing none, motion carried.
No, the vote has
Oh,
been prompted.
the vote has been prompted for approval of minutes.
We just need a voice vote.
What do you have to do?
Yeah, we're gonna have to do a voice
Take a voice vote from
Oh,
you.
voice vote? All in favor?
No, you say what your vote is.
Oh, aye, yes.
All in favor signify by aye.
Aye.
Oh, I'm sorry, she did the vote
Yes.
on the thing, so
Yeah.
it should show up, right?
Yeah, I got 4, so I don't, is everybody,
Commissioners, make sure
Log
that
in.
you indicate your vote and then save.
Mike, could you go back to the main
I'll do that.
agenda?
Oh.
Gingell, I don't think is on the right
Good.
screen. Can you go
Yeah,
see, make
you're-
sure Gingell's on the right screen?
You have to log in first, so just hit join this meeting.
Gotcha.
Present voting save.
okay.
Then your voting
I
will
see
pop up
you
on
now.
the next. No, it didn't show up.
Okay.
So I'm trying
Do I need to prompt the vote again then?
Yes, yes.
Okay, here, let me prompt it again.
Just gonna-
Start vote. Okay.
There you go.
Okay.
Thank you.
So we have 7 yeas, 0 nays.
Motion carried. Now, I see that we have no consent agenda items, so we'll skip that and go to the approval of the agenda.
Madam Chair, can I have a point of order that, can we just approve the communications? I don't know.
Oh, I'm sorry, I skipped over. Sorry,
Yeah,
thank you for
that's it for
catching
public
that. My
comment.
apologies, I skipped over communication.
Oh, public comment.
So we did approval of the minutes. Can you set the next item, please, Tracy? So we just did approval of the agenda, and now we have public
No,
comment.
we haven't done
Approval of the
agenda.
minutes.
Just minutes.
No, it was the approval.
Oh, I'm
minutes.
sorry, I'm so sorry. So yes, next we are on approval of the agenda.
Right, that's where I was at.
Okay, yes. So,
Are there any changes, corrections to the agenda? Yes, Mr.
Yeah,
Hoffman.
I think there's a mistake on the agenda. At our last board meeting, Commissioner Kokendorfer's resolution regarding masking was sent to the Lago Committee without objection. It turned out that should not have gone to that committee, and I talked to Commissioner Nelson, and she said that it should be on the Public Health and Safety Committee, and I don't see it on the committee, and it was referred to it, by the chairperson, and I think he's here today, could confirm that it was referred to that committee, but now it's supposed to be on this committee. So I'd like it to be corrected and put on the agenda. I think it's just a mistake.
At this time, yes, Commissioner Nelson?
Oh, I'm sorry, I have to. So in fact, Commissioner Hoffman is correct in regards to Chairman Woodward did refer without objection Commissioner Kokendorfer's resolution in regards to mask mandate. It was the inappropriate committee. It should have been referred to Public Health and Safety. I don't want to overstep Commissioner Chair Lube's chair over this committee. It is my understanding that it would have to first be approved by the chair prior to being placed on a committee. So I don't know what discussions have been had, but
Well,
So,
the chair's not here, the vice chair's here. And we all know it was referred to this committee, so it should be without objection. It should be on the agenda.
well, yes, Commissioner Gentle.
Yeah, so I just want to add maybe a couple points of order. So under our rules, any committee can refer an item to another committee through the referral process that's existed for a long time. So if the Lago Committee said, hey, this shouldn't be in ours, it needs to be a public health, it can be referred automatically that way without consternation. The other thing is if there's ever an item that is not on the agenda, regardless if it had been referred or not, this body today can make a motion to add to the agenda as part of the approval of the agenda. And it just takes majority votes to do that. So that is a possibility, and that's what I would recommend we do.
Because this is my first meeting and I have not consulted with my chair in regards to that item, I would defer to leave that agenda item off the agenda. I don't know how we handle that, but I'm not getting into that because I already know what that is about. I'm speaking on my behalf. I would defer to have the chair to make that decision, or we consult together, and at this time, she is not here. So I would like to keep that off the agenda until next meeting, or Commissioner Lubes can make the final decision of that. Do we have any other discussion?
What about Robert's rules?
I'm gonna ask you to stay over there, please. Thank you. Do we have any other questions or comments? Where's Patty?
I just
I'll
have a
make,
question.
oh, nope,
Yes,
go ahead,
Ken.
Commissioner
I'll wait
Kitchell.
for the
Yes,
chair.
Commissioner Gendel.
So I guess just a question, and I respect your position,
Yeah,
right?
this
You
I'm
know, I
not-
get it, and I appreciate that. And as the chair, you can determine what's on the agenda or not. So, you're essentially saying like, hey, we're not putting that on the agenda. I'm not running you over at the bus here. I'm just clarifying it. So we could object the ruling of the chair, and we could call a roll call vote. And then if there's not enough votes to overturn the rule of the chair, then it fails, and it doesn't go on this committee. Or we could hold and postpone it till next committee meeting. But there are procedures and there are ways to, address the question at hand.
Hoffman.
I'd like to make a motion that we add Adam Kokendorfer's resolution to this agenda today, because this is where it was referred, and we should take it up one way or another.
Support?
So I have a motion on the floor by Commissioner Hoffman, supported by Gendel. Can we take a voice vote, please?
Can we get clarification on the vote? So is, from what Commissioner Ginjal just shared a couple things that are different procedurally. Is it my understanding that if we take this vote right now, then it completely, if it doesn't pass, then it's off the agenda in the
For today.
future?
For today.
Or for today? So just point of clarification for today's agenda purpose. Thank you, Madam Chair.
Also, isn't this time for discussion before having the vote?
I can't hear you.
Do we have discussion before the vote? I don't know if that's how it goes, but I just wanted to make sure.
Yes,
Okay.
yes. So I'll start with Commissioner Cavell and then Commissioner McGilvery.
I'm going to vote no on this, the thing.
Thank you, and Commissioner McGilvery.
I too will be voting no, only because we have nothing on the agenda as to what that resolution was or anything else. It should have been on there if we're going to discuss it. So I'll be voting no.
Thank you. Can I call for the vote?
Yes, Hoffman.
Well, I'm sorry there's no backup for it, but if we want to take a little time out, we can get a copy of the resolution. We all saw it was introduced, but if the staff could give us a copy of it right now, if that would change your mind. There's no backup on the agenda because it wasn't placed on the agenda like I thought it was going to be. I think it was just a mistake. So you want to do that? We can get a copy of the resolution right now.
I'll still be voting no.
Oh, but okay.
So,
Go back.
yeah, I'm just going to consult with Tracy for a second. I believe that just advising the chair here that the motion was to approve the agenda. That was what was made by Commissioner Nelson. And was there a second to that? Was it someone?
It was Genjo.
Oh, okay, to approve.
Genjo has.
No,
That was the minutes.
Oh,
the
right.
minutes? Okay,
That was
was
the
there a
minutes.
motion to approve the agenda on the floor? Did
No.
you have one, Tracy?
No.
Okay, so we would need a motion to approve the agenda or.
Well, wait. That's where we had got caught
And then
up.
amend.
No, there's already a motion on the floor now to add this item to the agenda, and then if it passes or fails, then we vote on the agenda, either amended or as presented.
Oh, so you're doing it backwards? Okay. Okay. Tracy, could you announce what the actual motion and support is for the chair, please?
Yes, the amendment made by Hoffman, seconded by Gingell, is to add the Kokendorfer resolution regarding masks.
Now you say, is there any more discussion?
Is there any more discussion?
Can I just make a point of order?
Yes.
Thank you,
Commissioner
Ma-
Coon?
Thank you, Madam Chair. I think it would be more appropriate for Mr. Hoffman to make a motion to approve the agenda with that change. That way there's no motion to amend at the moment. So I would just suggest that the motion be to approve the agenda with the Kokendorfer resolution added.
Commissioner Genjo?
Yeah. So, Madam Chair, in spirit of trying to be helpful, I agree with Commissioner Kuhn. What procedurally we should do is remove the motion on the amendment to add the item. We should get a motion to approve the agenda with support on the floor, and then we can move the Hoffman amendment and vote it up or down, and then come back to the agenda, either as amended or as presented. That would be my recommendation.
Okay, thank you. Let's
Yeah.
go back.
So we need to withdraw, I'll withdraw my support of the Hoffman
And I'll
motion.
withdraw that right now so we can get a motion for the agenda.
Okay.
I'll move the agenda, or did you
So
already
moved
move?
by Genjo, supported by Nelson.
No, Commissioner.
Okay, then I move to add the Commissioner Kokendorfer's resolution to the agenda.
Support.
Supported by Genjo. Motion made by Hoffman.
Okay. So is there any discussion?
Is there any discussion? Yes, McGill.
What are we voting on? Are we voting on the amended budget now? Is that what we're doing?
Madam Chair.
Yes.
We're voting on the Hoffman amendment to add Commissioner Kokendorfer's resolution regarding the mask mandate to the agenda today. And if that amendment fails, that motion fails, then we're back to the agenda as presented.
Okay.
Mhm.
So now we're going to take voting to include Hoffman's item to the agenda.
Right.
Can you prompt a vote, please?
or is this for?
Yeah. Do I have to vote on here?
No, you will state
Oh.
yours verbally.
I vote for it.
There's just some weird thing why your vote isn't coming up.
I
but we'll get
can't
that
hear you.
fixed.
I can't hear you with that mask.
Well, you will. Whoever turns on at home.
So we have 3 yeas and 4 nays. Motion fails.
Oh, I got it. Okay, thank you.
So item was not passed to be added to the agenda.
Now we vote on the agenda.
Now
as
we will
presented.
vote on the agenda as presented.
Is there a motion?
Are there any change?
Motion.
Oh, is there a motion? Motion by Nelson, supported by McGilvery.
Sorry,
Are there any
Discussion.
discussion, are there any discussions in regards to the agenda as being presented?
Seeing none.
Seeing none, please
Prompt the vote.
prompt the vote. Thank you so much. You stay right.
Chair, if I could, oh, there we go. We have 7 yeas, 0 nays.
Motion to pass the agenda, or agenda passes. So,
Okay, motion carried. Now we will move to public comment. Now we will hear any public comments in regards to any agenda items on the agenda.
Is there anyone who wishes to speak?
Please come up, Ms. Kennedy.
Hello, Commissioners. My name is Catherine Kennedy. I'm from Lake Orion. And again, I have to complain about the lack of information provided in a timely manner for citizens to be able to review anything. This new system is awful. It not only does not allow you to jump to where you want to look at the documents. If it's in page 604, you got to scroll through the whole 604 pages to try to find what you're looking for. This is not okay. This is not what I would call open meetings for a public forum. I'm very disappointed by the continued ignoring of the citizens that come here and talk to you. So I really hope and pray you'll start to listen to the needs of the citizens of this county. We have too many resolutions being thrown around at our expense that are contrary to the best interests of the citizens of this county. How is that even possible? Isn't that your job, to look after the operational excellence of the administration of operations of our county for the benefit of our citizens? So why are we bending over backwards to make sure that we're not treating our citizens with the equality that they deserve? Why are we not dedicating all our tax dollars to citizens instead of refugees who we don't even know if they've been vetted for national security or health reasons? 30% of the migrants entering this country refuse a vaccine, but they're allowed in anyway. How is that helping the COVID situation? Everybody's claiming it's all people not wearing masks. No, that's not even it. There's a lot of clarification, but it's really critical that our rights are being taken away in this country by people that don't understand our Constitution, apparently, because a lot of the things that are in our Constitution are being violated left and right. Even at this council, we had the SBA Minority Development Program that got promoted just before the Supreme Court found Biden's minority SBA program unconstitutional. Has that been revoked or undone? That was approved prior to the Supreme Court ruling. I don't even know what this risk mitigation landlord thing that just got the last meeting, August 24th, the public service. They threw in the $10 million who knows what package that I don't think a committee has the authority to approve, number one. I don't understand how Woodward gets to sign for $750,000 and call it a communication by a variation from a rule. I don't get any of this. This just doesn't make any sense. I guess it's because I was from a business side of things. I'm very pragmatic. It's not about left or right. It's about right and wrong. And there's certain math that just doesn't work. And it doesn't matter how you want to change the wording or how you want to reimagine this and that. Math is math.
Kennedy, can you wrap your comments up, please?
So we need to really start focusing on the facts, not the manipulated facts that the new world order, or whatever they're trying to push us to, is trying to promote, which makes no sense at all. We cannot support our country with the Marxist ideologies that are being permeated and sent to all the children of this. It's just terrible. My grandkids, I am so worried about my grandkids because I've taught them that they have the rights.
Ms. Kennedy, I need you to
But they
wrap
need
your
to
comments
not be
up.
bound with all this debt that's being incurred and in violation of what's right for our citizens. This makes no sense. And now we're going to try to make sure it's
Ms. Kennedy, can you please wrap your comments up?
certainly. Thank you very much. So I know there was some discussion about Spectrum Health acquiring Beaumont, which would be a catastrophic mistake. Not only would we lose the greatness of our medical school locally, this is not a good thing. That's called monopoly. And the monopolies that have taken over this world are not in our best interest. So as citizens, we need to step up and speak up. So thank you for your time.
Thank you. Do we have any other public comments at this time? Hearing none, now we will move to communications. We have two communication items, A and B. We need to receive and file.
So moved.
Moved by McGilvery, seconded by Genjo. All in favor signify by, oh, sorry. Prompt a vote, please. I've been forgetting about that now.
Commissioner Nelson?
We have 7 yeas, 0 nays.
Motion carried. Now we will move to a regular agenda. And the first item on the regular agenda is item A. We will be getting a presentation from Beaumont Health and Spectrum Health. Come aboard. Go ahead, Marcia.
All right, good morning, everyone. And if I could ask you, thank you, to take that into presentation mode, I appreciate that. I am Julie Frame, and I am the chair of Beaumont Health's Board of Directors. And I'm joined here today by two of my colleagues, Megan Petsko-Sweet, who is part of our government affairs team, and Eric Woody, who is also part of our team in our communications group. So both of them are here and will help me as necessary as we go through our presentation. So I do want to talk about our path forward, which is really for Michigan, by Michigan, and I'll do my best to answer what I think are some of the most pertinent questions as I go through my presentation, and then certainly we'll have as much time as you allow, Madam Chair, for the discussion. So if I can have the next slide. First and foremost, thank you. Thank you for giving me the opportunity and for giving all of us the opportunity here at Beaumont Health to speak with you and to answer your questions in person. I greatly appreciate it. It is, I'm very excited about this opportunity, and I think I can share some of that excitement and perhaps share some of the enthusiasm as to why this will benefit the entire state. So next slide, please. So today what we've shared is that Beaumont Health and Spectrum Health are exploring how we can best serve our communities by creating a combined health care system that is for Michigan and by Michigan. Next slide. As we talk about healthcare and what's changing in healthcare, our focus is on ensuring that healthcare is affordable, that it's accessible, and that it's equitable across the entire patient spectrum that we serve. And so I think it's really important to recognize that healthcare is changing significantly. Beaumont Health is the leading healthcare system in Michigan, but we compete with 3 national systems in Michigan that are more than 3 times our size, and that's Tenet, Trinity, and Ascension. And so competing with those 3 systems that are at the national level is very challenging for a local system that operates on its own. So as healthcare continues to evolve, there are a number of factors that we have to consider. There's been a tremendous amount of healthcare reform. I certainly expect that to continue as we emerge from COVID. There are new models of care. There are very different patient expectations as a result of COVID and other actions. And then there's just the financial realities of running a healthcare system today. I would say, and I alluded to it, that COVID-19 has accelerated some of the changes that we are experiencing within the healthcare system. It is transforming not only healthcare itself, but the way insurance coverage is dealt with relative to healthcare. And so what is really in front of us is that if we don't respond, and by we, I'm saying Beaumont Health, speaking on behalf of that organization, if we don't respond to the competition and to the needs of the public, then we risk losing our competitive position. We risk losing our ability to serve our communities to the best of how we know how. And so it's really important that we talk about what we need as we go forward as a healthcare system. So next slide. So why is Spectrum Health a good partner for Beaumont Health? First of all, our organizations are united in our commitment to Michigan. We are both nonprofit systems. We share a similar mission, vision, and values, and we have just an outstanding track record of providing extraordinary care for our communities. That commitment to quality care is so important, and I want to emphasize that that is not changing, and we bring complementary clinical strengths to the tables together. So for instance, at Beaumont Health, we have 19 U.S. News and World Report nationally ranked specialties. Spectrum Health has a top 50 children's hospital and what's referred to as a 3-star cardiac surgery program. And a 3-star cardiac surgery program is the highest rating possible from the Society of Thoracic Surgeons. So together, we can raise the bar with our complementary skills as to how healthcare is delivered throughout the state. Additionally, at Beaumont Health, our strategy has been focused on having a health plan to provide additional and better options for our patients and our communities. We do not, at Beaumont Health, have a healthcare plan now. Although we have explored several options as to how to address this deficit, we feel that by joining with Spectrum Health and in essence, acquiring half of Priority Health as part of Beaumont Health, this will allow Beaumont Health to increase our focus on a patient-focused health plan, which is critical as we move forward. We talked about what's changing in healthcare. It's very important that we have that aspect as part of our package for our constituents. It will also help us improve physician alignment, as we will have the flexibility we need to develop value-based arrangements that reward physicians for delivering high-value care. Next slide. So in addressing, I think, one of the concerns that many have voiced is, where are these markets, and are we losing our healthcare system? And the answer is no. We are in very complementary markets. We do not overlap. The systems serve separate communities, and we serve their unique healthcare needs. The best way to run a community-guided health system is through local control. However, we can learn from one another and build off of each other, and that is our goal. So where are we at today? Next slide, please. So the two organizations completed a letter of intent in June. We have also completed our due diligence and signed an integration agreement at the end of August. This is what the two organizations have to do to be ready to move forward in combining the two organizations. The current status is we're awaiting regulatory approvals. We're awaiting the Federal Trade Commission's approval, as well as the Attorney General of Michigan's approval. There is a backlog at the Federal Trade Commission. That has been something that's been spoke about, and we are working with them. We're in our second 30-day period that will end next week, and we hope to hear from them at that point in time and be able to move forward. As we go forward, there will be a board of directors at what we call the BHSH level. That is the parent of the 4 divisions served by this combined organization. One division is Beaumont Health, one is Spectrum Health West Michigan, one is Spectrum Health Lakeland, and Priority Health is the 4th. The Beaumont board will appoint 7 members to the BHSH board, and the Spectrum Health board will appoint 7 members to the same board. The 15th member will be Tina Fries-Decker, who will serve as the CEO and president of the organization. And then a 16th board member will be added somewhere between 6 and 8 months, as indicated by the agreements we have signed, to make the total number of board members 16. Additionally, we have an integration office that is beginning to come together. We are doing the initial planning in both of our organizations, and as soon as we have closed the transaction, we will then combine those plans and begin to move forward with the transformation and integration. So I hope that answers some of your questions. However, I'm more than happy to take questions and answer anything that you have on your mind. So you can go to the final slide there. Thank you so much, everyone, for that. So
Thank you for your presentation. Now we'll open the floor to the commissioners. Do you have any questions or questions for Beaumont today?
I just have maybe 2.
Yes, Commissioner Genja.
Thank you, Madam Chair. So just 2 quick questions, and to the extent you can talk about it, but in regards to the transaction of Spectrum acquiring Beaumont, is it driven through any private equity capital, or is it all private, non-private equity money?
Okay. Well, first, Spectrum is not acquiring Beaumont Health. Both organizations are nonprofit organizations, and we are combining our assets. So we are becoming a new nonprofit organization with combined assets from the 2 of them. So there's no acquisition occurring. There's no private equity or any other financial institution involved. This is simply a combination of assets of both of the nonprofits, and then we choose to operate and move forward together once we have signed the deal.
So, Madam Chair, if I may, my second question is just from an operational standpoint, if it is just a combination of assets, to use your words, will the two entities run independent with a parent governance structure over top of both of them? Or will they, or is the intent that the two entities function, operate, and become managed as one organization?
So the parent is the BHSH organization, which I described the board, and the 4 divisions operate under that board. Each division, including Beaumont Health as its own division, will have a separate board of directors, which will have its own responsibilities and a number of aspects that they must deliver for the organization. And the parent board, if you will, or the system board has a very limited reserve set of responsibilities that they action. So that's how the parent board functions. For example, we would approve something at a certain capital level for any division would come up for approval at the system board, as you might expect.
Thank you.
Is there any other questions? Yes, Commissioner Nelson.
Thank you, Madam Chair. Thank you, Julie, for giving us a brief overview. I appreciate the information, so thank you.
You're welcome.
One question, what ultimately led to the decision of combining the assets of both Beaumont and Spectrum Health?
So there are a couple factors. One is the ability to better utilize our financial assets as we combine those organizations. I think it's important to recognize that this will allow us to focus on investment, on technology and facilities to care for both communities. So I think those increased financial resources that we will have available to us as a larger organization is very important. It will also allow us to have some increased clinical program planning and really utilize the capabilities of both organizations and bring that together and share that. It's interesting that many of the physicians at Spectrum Health originally trained at Beaumont Health. And so there's already a great deal of communication that occurs between the organizations in terms of sharing what we can. The two organizations also worked very closely together through COVID to address the concerns of their communities. So this is, to a certain extent, it's a natural extension of what we have been doing to support our communities together.
Excellent. Thank you, Madam Chair. One more.
You're welcome.
And lastly, what do you foresee as the biggest barrier as we do move forward with merging and combining Beaumont and Spectrum Health?
That's a great question. I think with any organization as it goes through a transformation, the biggest challenge is to bring everyone together with one common mission and to share that and energize the entire organization. And that is, it's interesting that usually when you look at transformations of this type, it's not so much the operational side that is ultimately the challenge for the combining. It is the cultural side. And so we're very aware of that. And I'm very aware of that. I will be the new chair of the BHSH board. And so in that chair role, it will be something that I continue to emphasize and ensure that we're addressing appropriately as we go forward.
Thank you, Julie.
Commissioner Agenda.
Yeah, Madam Chair, just one last question. So I guess, in regards to Beaumont and Oakland County, and Beaumont being one of the largest employers in Oakland County, and I can appreciate the merger and the potential economies of scale that you'll get on purchasing equipment and other things. Looking at the map, the two entities have different footprints. So the question is, do you foresee your efficiencies coming through labor and your labor forces in the communities that you serve? Or do you see it as they're distinct and operating independently because of the nature of their footprint on the map that you showed, which is, depicting that they're very complementary?
Absolutely see them as distinct and separate. We do not expect any change. In fact, we'd love to hire more staff, nurses and staff at our organizations right now. As you know, there's a nursing shortage across the country, and that is particularly challenging for all systems right now. So if, we don't anticipate any hospital closures. Nothing is planned in that way. So I think you've hit the nail on the head that, we operate as two distinct systems in two distinct markets, and we'll continue to do so.
Thank you.
Before I allow Commissioner Cavell to speak, I just want to remind commissioners in our bottom lower right corner, we have a green button that says request to speak. If you could hit that button so I can keep everybody in proper order of when they ask to speak. Thank you. Now I'll turn it over to Commissioner Cavell.
Thank you, Chair. Hi, Julie.
Hi.
Hi. And also, hello again, Eric. First, props to Eric for giving me a tour and conversations about this, so I appreciate you, the time you put in. I have two broad questions kind of based on, I think there's like an air of mistrust, right? And that's not born by you, and that's just how things go. So just to put that out there as one thing to begin by saying, you talked about making things accessible and equitable for Michigan by Michigan, but also you can only do so much to that end because you're part of a larger system, right? Healthcare in America. So how are you going to be more accessible and equitable for, say, this health plan? Who counts as patients in that health plan if it's patient-focused? Is that people already with insurance, or will you delve deeper into the underinsured or uninsured? With employees, right, you need more nurses, and you had to fire a bunch during the pandemic because of non-necessary surgeries, or whatever that's called, selective surgeries. When you bring back more nurses, or when you increase the employment of your folks, are you going to allow them to be unionized? Are you going to do more towards that end? Understanding that to an extent you're stuck in the middle.
So, and I'm going to ask Megan for some counsel on this. I believe that all of the nurses that were put on leave were offered the opportunity to come back. Not necessarily all of them took it, but while there were some nurses and other staff put on temporary leave, as we had to during COVID, in March, April, May of 2020, in order to serve the community, we had to stop elective surgeries. Megan, am I speaking correctly? I want to make sure I have that.
Yes. So in March, April, I believe it went into May and June as well last year, we followed the governor's executive order, which required all systems in the state to stop elective procedures. So, Commissioner, I believe that's what you're referring to. And to Julie's point, if we could have redeployed them to a different area, if they had a skill set that could have been utilized in a different area for COVID patients, we absolutely redeployed them. And then when that executive order was lifted, we restarted elective surgeries and brought them back.
So I want to be clear about that in terms of where we are at. Let's see, the first part of your question was about how do you make this equitable, and what does combining these two organizations allow us to do? Certainly from the Beaumont Health side, having access directly to a healthcare plan that is value-based allows us to better utilize that internally, work with our physicians directly, and create additional ways to provide that value-based care to our communities in total. So I think that's a really important aspect, and I don't want it to go overlooked, because that system will allow us to move forward in that manner. To answer your question about who do we serve, we really serve in the Southeast Michigan area. We serve the 2 million people within our overall community. Now, they have choices, of course, but we serve them. And again, I'm going to look at Megan, and we may have to get this data specifically for you, and we're happy to do that. But the number of cases that we take on that are outside of sort of the insurance world, I don't know if you have that.
Not offhand, Julie. Oh, I'm so sorry. Not offhand, Julie, but we can certainly get that for you, Commissioner.
Thanks.
Sure.
Well, and I've talked with Eric about that, so I'm thinking more, Julie, future casting, right? In the future, when you have a health plan, will you be able to go that last mile into communities or work with people that have been underinsured or insured? Is that part of the thinking? Yeah.
Yes, we do that now in many communities, and I would expect us to continue to do that, and frankly, to increase that. One of the big changes in healthcare is the really caring for whole lives versus caring for a particular ailment at a particular time. And so as we look at value-based care and caring for patients over their entire lifetime, that is a very important aspect of what we plan to do and how we plan to move forward.
Okay, thank you. And one last thing focused on community side of things is, I know from having conversations with Eric and reading some of the documents that y'all have shared, that, and again, understanding that you're kind of stuck between a rock and a hard place, right? That you don't run the structure of healthcare in America, you're just trying to do what's best. Mental health seems to be a rising issue. What do you see happening post-merger with that and your role within that?
Mm-hmm. And I agree, mental health is a very significant issue, and we certainly recognize that. Beaumont Health is just about to open our new mental health hospital, where we have 140 beds that will be dedicated entirely to mental health. And, you know, we felt it was important to have a space that was dedicated to that, given the increasing awareness, I wouldn't say importance, but awareness of how important mental health is and some of the challenges that we as a society are facing. And certainly COVID and the whole situation around COVID has made that even more challenging. So we are very excited to be able to open this new hospital very soon.
Okay. Thank you, Julie and Megan, and thanks, Chair.
Thank you, Commissioner Cavell. Do we have any other questions? Commissioner Nelson.
Thank you, Madam Chair. Julie, with the mention of the new hospital of 140 beds for mental health, out of the 140 beds, how many are slated for youth or adolescents?
I don't know that number off the top of my head. We can either get that, or Megan or Eric, if you happen to know that, that would be great. But we will get that for you.
That would be great. Thank you so much. Thank you, Madam Chair.
Thank you.
And I want to be clear that I misspoke. It's 144 beds. So if you see that, I want to be clear that I misspoke and said it was 140. So it's 144.
Thank you for that correction. Do we have any other questions, commissioners? I see none. Now we will make a motion to receive and file the presentation from Beaumont Health. Motion by Nelson, supported by Hoffman. Please prompt the vote. I'm getting there. It's practice. I got a little more time. Thank you.
We have 7 yeas, 0 nays.
Thank you. Motion carried. Now we will go to. Oh, and thank you to Julie and the Beaumont team for the wonderful presentation today. Thank you.
Yeah, thank you for your time, and I really do appreciate your questions and your support as we go forward. So thank you so much.
And Tracy, can you just make note of those couple items that they're to get to Commissioner Cavell and Commissioner Nelson so that we make sure we circle back with Beaumont to get all of that? Thank you so much. Now we will move to agenda item B, which is fiscal year 2022 PA Cooperative Reimbursement Program, CRP Amendment 1.
Motion.
Can you please announce yourself and your name?
We need a motion?
Oh, I'm sorry. Motion by Nelson, supported by Gendro. I'm moving too fast now. Sorry about that. Now I'll turn it over to you.
Good morning, Commissioners. My name is good afternoon now. My name is Markeisha Washington, and I appear on behalf of the Prosecutor's Office. I am Chief of our Family Support Division. Appearing with me this morning is Justin Davis. He's also from our Prosecutor's Office. He's Chief of Training and Policy. Appearing via, I say Zoom, but GoToMeeting would also be Suzanne Hoyer from Friend of the Court. The Family Support Division at the Oakland County Prosecutor's Office is a 4D child support enforcement program. Our funding is a cooperative effort with federal, state, and county funds, which allows us to collect child support on behalf of from parents who are legally obligated to pay, Today, I request that the board amend our budget to allow us a 2-year amendment for 2 more years of funding. This would allow us to continue to serve our county's needs by establishing paternity, locating absent parents, and establishing child support orders. Besides our ordinary expenses, meaning our normal salary expenses, our process server fees, and supplies expenses, the additional funding will help our division come into the 21st century. Unfortunately, while many other prosecuting attorney offices and Friend of the Court offices worked remotely, during the height of the pandemic, our staff was not able to do so. When our prosecutor, Karen McDonald, took office, she was not only concerned about the health and safety of our employees, but she was also concerned about the lack of technological devices. With her approval, as well as the state's approval, we were able to purchase 24 laptop computers and cell phones so that when the COVID numbers began to spike once again, our staff was prepared. However, we still have a long way to go. Our staff is committed to working with Friend of the Court and Suzanne Hoyer, and making sure that we are ahead of the technological advances and that we are exploring all opportunities to make sure our offices continue to work efficiently. Thank you so much for your time, and I'm available for questions.
So now we'll open the floor to commissioners. First up is Commissioner Coon.
Thank you, Madam Chair. Just a couple questions. Thank you for coming today. Certainly
thank you.
appreciate your presentation. How does the $4.7 million 2-year funding for Title 4D compare to the prior year's funding?
Yes, in this particular case, in most cases, this is the first year that the state has decided to do a 2-year extension. In the past, our contracts have been for 5 years. Based upon COVID, the state has elected to exercise and extend our contract by 2 years. And in this particular case, the monies that were allotted were just shy. For example, they were less than what we were previously granted, but it was a little bit more. For example, and for the fiscal year 2021, we were granted $2,299,000, but case in point, for fiscal year 2022 and 2023, the state has granted us $2,3680,000, so just shy of what was granted previously.
Okay, thank you. Just, Madam Chair, can I just ask a couple other? I know that according to the documentation, this funds 25 special revenue positions, although the resolution says 23.5. I'm not sure that's important, but can you tell us generally what type of positions are being funded with this grant?
Absolutely. We currently have 4 APAs, including myself. We have 3 investigators, and the remaining positions are our support staff. So that makes up, and we have 1 part-time not eligible. So in fact, we do have 23.5 employees in our division.
Thank you very much. Thank you, Madam Chair.
Thank you. I have a question for you. On here, it stated that is the only, and you can clear this because I'm just trying to get clarity. It says something about our general fund match, so that $35,000, that's the only thing we needed to be responsible for to match from our general fund. Is that what that means?
35.
I'm sorry, it's in the policy analysis on my screen. Is this where she was, is that, okay, so she know what I'm. Michael, can you help me with that question? Is that what, that was it? That was just, okay. So that's the only thing that's recommended from us as a general match?
Because the funding side of it is, I think there's some federal funds to it that are passed through the states, and there's also some state funds as well.
Oh, okay.
Yes, and just to clarify, so our budget is actually 66% is funded by the state. And as he indicated, is passed through federal funds to the state, to our office. And so we come before the board and ask for the remaining 34%.
Got it. Okay, thank you so much. Do we have any other questions from, oh, wait, let me go back. Sorry, I'm learning. Okay. No other questions? Oh, sorry, Charlie Cavell.
No, you're good. Thank you,
Commissioner Cavell.
Chair Powell. You had made me think of something. So 34% is covered by the county.
Yes.
And we are thinking about giving you 35,000 more because that's 34% of the increase. Because I also am not following the math, and forgive me for. Yeah.
I am, unfortunately, the page numbers were changed from yesterday to today. And so there is a budget description that is.
So you're just requesting further clarity on the 34,000?
Yeah, I just don't know why it's that and not higher, because I thought 34% of 4 million is more.
So I'm not sure if I understand the question.
34% is this.
Mm-hmm.
So I think what it's also getting into is, because this is a special revenue fund, there is a CRP budget that we have set up within the budget book, and within that budget, there is going to be, within that 34%, some portion of that will be general fund dollars, and that's the 34,000.
Oh, okay.
Okay,
So does that make more sense?
Yes.
Okay, thank you.
Thank you.
And I think if you look in the special revenue section of our budget book, you'll find
Okay.
where that's located.
Thank
Mm-hmm.
you, Michael.
Thank you.
Thank you.
Thank you.
Thank you very much. I see there's no other questions from commissioners. Please prompt the vote. Yes, I did it right. Okay. I'm wrong here.
We have 7 yeas, 0 nays.
Thank you, commissioners.
Thank you, motion carried. Thank you. Now we will move to item C, authorize execution of agreement for preliminary acceptance of the fiscal year 2022 Local Health Department Comprehensive Agreement Grant Funds. Need a move by Hoffman, supported by Nelson.
Okay, so what you have here before you today, Commissioners, is a procedural resolution, essentially. Due to the fact that the Michigan Department of Health and Human Services has provided certain lead time with grant, this particular grant agreement and getting the contract executed and reviewed at the state level and everything pertaining to that for the upcoming fiscal year. In order not to, I guess, have any gaps in service to the communities, is that we need to get this approved by the October 1st deadline that the MDHHS has provided to us. So what this is essentially asking is that they authorize a preliminary execution of the agreement, and then subsequently in the next round, because I have seen it begin the grant review process within the county, is that the actual agreement to approve the grant will come through at the next public health and safety meeting. So this is just providing, again, that authorization of the chair to execute the agreement so we don't have any gaps in services. It's going to be the same with the next one. What I can tell you is that the grant period is from October 1st, 2021 to September 30th, 2022. For this particular agreement, it will fund 60 special revenue positions, and it will create one special revenue full-time exempt lactation specialist. And then these are essentially the same kind of programs that the health department goes into each and every year for WIC, nurses, everything like that. So, but you'll, again, see all those details when it comes forth next round.
Could you please state your name?
Oh, Michael Andrews with the Board of Commissioners, and I think I actually have Stacy Smith from the Health Department here as well. So Leanne couldn't make it today. She had some prior, I guess, scheduling conflicts, correct, Stacy?
Yes.
Yes, so she had just asked that somebody from the board staff and the Health Department provide a little detail to this item.
Okay, Commissioners, do we have any other questions? Oh, wait, let me go back. I'm learning. Hold on. Details. Sorry. Oh, yes. Okay, we have questions. Starting with Commissioner Kuhn.
Thank you, Madam Chair. How does this 11.4 million funding compare to prior years?
So actually, I'll leave that to Stacy to chime in.
We can't hear, Stacy.
Oh, we don't have enough volume.
I can't hear. Oh, man. You may have to call in, Stacy.
If she logs out and logs in again, can you reset her?
She's panicking.
Yeah, that's all right.
Don't panic.
Okay.
Yes, Genja?
Madam Chair, I know I'm asked, but maybe this will help. So, Mike, if I'm understanding correctly, these are continuation grants that we've historically had, historically budgeted, and are currently budgeted in the existing forward-looking budgets that we're going to adopt. This is a procedural matter because in order to get the grants, we have to execute the grant request by October 1st. But the typical board process is going to be followed, from what I understand you're saying, as far as them coming through. So the reality is these are continuation grants consistent with past practice and past funding, and they are budgeted.
That is correct. This is just, again, a procedural request.
Got it.
Like Commissioner Gingell has mentioned.
Thank you.
Thank you, Genja, for that. So we're just
So I think
waiting
we
on.
could actually, because you will see the agreement come through, Commissioner Kuhn, at that later date where they'll actually have to make a yea or nay vote on the actual agreement itself.
Well, maybe you can answer some others while Stacy
Sure.
is trying to get connected here. What kind of time frame are we looking for the full grant review to be completed?
So I know it just began either yesterday afternoon or this morning. I'd have to go back and look at the timestamp on my emails, but I did see that begin here within the last 24 hours.
Okay, that's when it began.
Hi, Michael.
Oh, there it goes.
Yes, we can hear you now, Stacy.
Okay, Okay, so I guess the first question, last year we received $15 million, but that also included funding for COVID. This year, Michigan Department of Health and Human Services decided to break those two funding sources apart. So that's the second item that we're presenting. So the 11 million is typically consistent with what the funding levels that we receive each year. As far as the final agreement for the 11 million, we have yet to receive that, but I'm pretty sure we will receive that soon, and we'll be circulating that through the grant review process.
Okay, thank you very much. Appreciate it.
Next is Commissioner Cavell.
Thank you, Chair. This might be more for you, Michael. Is it normal to have the chair be, right, is that part of the procedural thing? Is that the chair signs off on this so we don't?
No, so you bring up a good point. Within our grants policy, especially for acceptances of agreements, we do not have that exemption rule like we do with applications. So in this particular case, if the way that I understood it is that if we were to not kind of authorize this preliminary grant agreement acceptance, is that there may be some gaps with services that would be provided to the citizens, and then even paying some of the nurses and everything like that. So there may be furloughs that would take place, and it might only be for a week or two, but they don't want, we definitely don't want to not provide that to the citizens of Oakland County.
Okay.
But again, it all comes back to the time frame that was set upon the county with their own approval process, but also notification from the state.
Okay. So this doesn't usually happen when
we're trying to address certain things, and we definitely have or have been urging departments to work with the state to try to get advanced knowledge of all these and try to get it through the review process at that level quicker, so that it can come through the Oakland County Board in the proper time frame. Yes.
Okay. So it's a state thing.
Essentially, yeah.
Okay.
Okay, I see no other speaker requests. So are there any, oh no, is there any further discussion? Oh, please prompt the vote now. Thank you.
We have 7 yeas, 0 nays.
Thank you, Stacy. Thank you, Mr. Andrews. Now we will move to the next agenda item, which is item D, execution of agreement for preliminary acceptance of fiscal year 2022 emerging threats local health department fund. I need a motion. Moved by Hoffman, seconded by McGilvery.
So again, this is a procedural request to the board by the department to do the preliminary acceptance. You'll again see this later on. Just a quick detail on this is that the emerging threats local health department funds are basically funding to support COVID-19 response, including contact tracing, case investigation, infection prevention, COVID vaccines, and other regional lab support. So this is a $9.5 million roughly grant, and it will again run from October 1st through 9/30/2022.
Is there any further discussion on the item? Hearing none, please prompt the vote.
We have 7 yeas, 0 nays.
Thank you, Mike and Stacy.
Yeah.
And now we will move to the second public comment. Do we have anyone here for the second public comment session?
This is for items not on the agenda.
Yes, items not on agenda. Thank you. And could you please just state your name?
Yep.
And I don't know, I'm sorry, just a question for are we doing this city too? Oh, yeah, community. Can you please just state your name and your community?
Yes.
You're coming from.
Yep.
Thank you.
My name is Deanna Jamil. I live in Walled Lake, so I think that is District 7.
I'm here today because I'm a concerned mother of 2 children. I recently had to unenroll them from school due to the mask mandate. Basically, I have a little bit of background about myself. I have my master's in social work. I worked for Child Protective Services in Wayne County for almost 5 years. With that being said, I believe that making our children wear a mask is a form of child neglect. According to child protection law in the state of Michigan, child neglect means harm or threatened harm to a child's health or welfare by a parent, legal guardian, or any other person responsible for that child's health or welfare. That occurs through the following. Article number 2, placing a child at an unreasonable risk to the child's health or welfare by failure of the parent, legal guardian, or other person responsible for the child's health or welfare to intervene to eliminate that risk when that person is able to do so and has or should have knowledge of that risk. In my opinion, masks are a form of child neglect. Studies have shown that only N95 masks work. And how many of you guys are wearing an N95? I think maybe 1? None? 0? None of our children are wearing N95 masks, and the ones that they are wearing clearly state that it does not protect them from COVID-19. No one knows the long-term effects of mask wearing has on children, but as a mother, I err on the side of caution, and I do my research. That is why I've decided to unenroll my children from private school. Recent studies have shown the psychological effects of wearing a mask has on a child. It was a very hard decision to take my child out, considering this is her first year of like actual kindergarten. And I just want to kind of take you guys back in time when you were in kindergarten and when you were there and you would raise your hand and get a question right and how important a smile was of encouragement. And we're taking that away from our kids, not seeing the teachers smile or even their kids smile. It's just, it's hard for me to not get emotional about it. Also, I'm getting a lot of backlash from people that it's all that my child knows wearing a mask, it's just a mask, but I refuse to accept this as a new normal. God has given us a face and a smile for a reason. I don't know about you, but I love seeing smiles, and I love my daughter's smile, and I love when she gets comment on her smile. I ask that you please reconsider this mask mandate on our child. I am not anti-mask, however, I am pro-choice in terms of my child, my choice. I urge you to please put your politics, agenda, and personal interests aside and put our children first. God bless you, and God bless America.
Thank you. Do we have any other public comment? The floor is open. Yes, you can come. Thank you. Just state your name and your community, please.
Hi, my name is Colleen Zamet. I live in Beverly Hills. I wasn't planning on commenting, and apologies because I came in a few minutes late, but you were discussing whether or not to put, I think it's called the Hoffman resolution onto the agenda.
Kokendorfer.
Excuse me. Thank you. And it got voted down. I guess I just wanted to comment and say I'm failing to understand why something of such importance to such a large segment of the community keeps failing to even get on the agenda, and it seems like that just leads to more and more Board of Commissioners meetings with hundreds of angry parents outside and then hours of public comment. So if it's able to be discussed at all, I'm just curious to know why it cannot even be put on the agenda for actual discussion, and that is my comment. Thank you.
Thank you. Do we have any other public comments? Yes, you can. Just state your name and community, please.
I'm Meg Harmon from Rochester Hills. You all just stood and pledged allegiance to the American flag and God. However, your actions, the lack of respect to serve both our country and its our county and its people, are on repeat, meeting after meeting, vote after vote. Your actions of being unable to lead a department meeting because you are new or stand-in is only a disgrace. But the proof of lack of leadership, taking the easy road out, serving the New World Order and cabal Satanists is what you continue to prove meeting after meeting. Did the health department take funds to mask our children? They did. After our state emergency ended? They did. Did you, our schools, both take funding for serving Satan Fauci, who has been wrong in every aspect of this pandemic? Again, yes, you did. Yes, you chose for us, the people, to be indebted to those that are corrupt and denying all facts, as well as failing to serve those that elected you. Our Constitution was a guideline our founding fathers created to protect the people. However, you, the Commissioners Board, continue to ignore, point the finger, and deflect from standing for the people, all while you betray the Constitution that was created to keep evil at bay. Your failure to properly put together an agenda that your people asked for, and then given the opportunity to educate yourself, which you should have already been done, because that's what's front and center in our community for some time, again shows your inability to do your job. You should be ashamed, denying for yet another excuse, continuing to fail Oakland County children. You openly reject facts provided by our local community, our base doctors, nurses, PPE specialists, as well as other qualified community members that work within the system. Your tactics of removing masks, once Whitler had her hands tied, waiting until days or...
Excuse me, ma'am.
No, and wait, I'm speaking.
Excuse
no,
me.
it is a comment section.
Excuse me. Excuse me. What you're not going to do...
Okay, your tactics of removing masks, once...
Excuse me, what you're not going to do is
her
disrespect
hands
us
tied,
in our
waiting until
meeting.
days after or days before school started to try and deflect from parents standing up is a base-level military tactic used in basic training to mentally wear down soldiers. We are prepared with not getting tired. We will continue to fight your corruption and your money schemes until each of you are out of office and preferably in jail for crimes against
Your time is up. Thank you very much. You have a blessed day. Thank you very much. Have a blessed day. Thank you. Do we have any other comments? We don't. You do? Thank you, sir. You can come up. Can you please state your name and your community? Thank you very much.
My name is Dominic Kuda from Waterford. I don't have much to say. I've been asking people. I'm open-minded. I've been questioned quite often why I don't believe in the mask or believe in the vaccines. And I find it hard that we have not, and I tell them I find it hard that we have not found exactly where this has come from. I am called a conspiracy theorist over and over, but I do believe it came from the Wuhan lab, and I do believe it was done on purpose. So I'm just here to say I have a hard time believing in the men and women that I believe started it, that are also giving me advice on how to end it. I'm in construction, and I guess I have 5 young kids. One of them's on the job site right now. If a guy comes with a fully loaded dump truck, backs it up on my driveway, and cracks that whole driveway, he's not the guy I'm going to ask for a bid to fix that driveway. I'm going to go on the outside of somebody else. And that's kind of how I look at this right now, and how I look at the advice coming from both Fauci and everybody in the health department down from there. That's it.
Thank you, sir. Thank you very much for your comments. I know. Ms. Kennedy?
Thank you, Commissioners. I actually feel compelled to speak again about the Beaumont Spectrum Health scenario that was discussed and presented today. This is a bad idea for our county. Doesn't anybody remember the Chrysler Fiat deal that was a merger of equals? How'd that work out? How many thousands of people lost their jobs? This is what the county will get with a merger of equals with Spectrum Health and Beaumont. This is not what we need for our citizens. We have very good health insurance in our country because we're not socialized medicine. The Canadian Prime Minister, before Obamacare was passed, went out publicly and told us, don't do the Obamacare. It'll ruin your health care system. They were right. It decreased the quality of care and did not come in more affordable like they advertised. It was never more affordable, and you could actually fact check me. About a month after they passed Obamacare, they finally allowed the General Accounting Office of this country to come forward and tell us the truth. That actually cost us way more money. We were actually getting rid of a lot of the good benefits we had in our current systems. And why? Because a bunch of politicians thought it'd be a good idea to make it equal. I'm sorry. That's called socialism. And this is an attack on our healthcare system is a very critical thing because we will no longer have a good system. Why do you think people come from other areas of the world? Not just to live here, but for healthcare. There's a lot of people that come from other countries because our system is not the same corrupt, socialized medicine that exists in most of the world. So why would we do anything that would allow it to be turned into that? That's all. I mean, my daughter would probably be dead if I didn't have an option to pay private insurance to be able to choose a hospital that I took her to. But she was actually one of the first people to use immunotherapy treatments that are now standard in cancer treatments. She's survived, but only because we had innovation in our country, in the healthcare system, that is because we're not socialized as a country. Thank you very much.
Thank you, Ms. Kennedy. Do we have any other public comments? Here none. I want to thank everybody here today who attended our meeting, and our meeting is. Do we have any other business? Yes, McGill.
Thank you, Madam Chair. I just want to say, for your first meeting as chairman, you did a great job, and I appreciate it.
Thank you. Thank you very much.
It's a learning process. So.
Yes, it is, and I know that. So, and I'm working on it, and I thank you all for the encouraging words. Do we have any other business? None? Okay. Adjourn. Our meeting is adjourned at 1:39. Have a blessed rest of the day.
12:39.
I'm sorry.